This conference will now be recorded.
Yeah. Last class, I was just discussing about what can be the structure of the skin, and I just told you, going back to the previous class, okay, this is my domain of expertise, that is what I keep telling you people, sharing with you people. Okay, there's an upcoming area, there's a novel area which has been identified, which many products are making into the Indian market also, because earlier there were products across, but India there were very few products. Okay, so basically, as you know, as I told you, uh, skin is made up of three different layers to categorize. Are you able to hear me, all of you? Hello?
Yes,
Hello?
sir.
Yeah, Haripriya. Yeah, thanks, ma. Thanks, thanks. I just keep asking you people because I just want the connect to be there. That's it. Nothing else. Okay. So basically, it comprises of three different layers. One is epidermis, the other is dermis, and the third is subcutaneous. Okay. The epidermis again is made up of four different layers, with stratum corneum being the outermost layer and the basal layer being the innermost layer. So what will happen is cells originate basically from the basal layer and migrate towards the top, okay, and become stratum corneum. That is, become more or less cornified, or the cells become dead. And what will happen is once they reach the stratum corneum, usually what will happen is the skin is shed off, like we have said, they could have seen. The skin will get renewed now and then. That is what we have seen. That is what is the normal process that's going to happen. And the next is the dermal layer, which is the important layer, which is the live tissue. That's what I kept saying, because it contains what is known as the blood vessels, nerve endings, sweat glands, sebaceous glands, so on and so forth. And epidermis is again there is basically a two layers. Again, if you want to segregate them, again the viable epidermis and the dead one. That is, stratum corneum is usually the dead layer, and the rest of the layers can be called as the viable epidermis or the living epidermis. And so formation of most of the molecules, okay, can happen only if, for example, if the drug is able to pass through stratum corneum. So passage of the drug through the stratum corneum is a rate limiting process. Okay, that is what everybody has to remember. So once the drug passes the stratum corneum, it will be easy for most of the molecules to penetrate, okay, deeper into the skin. That's what will happen. Okay, usually in case of, there is something called even dermal drug delivery. Okay, when you go deeper and deeper into science, that is what is called as dermal drug delivery and transdermal drug delivery. Okay, these are two the well-defined terminologies. In fact, most of you have to realize, especially people who are opting for higher studies. Yes, there's a lot of scope in higher studies. That's what I always tell you people. Okay, unfortunately, many a times I will not have chance to interact with you people. Yes, that's what will happen in your final year, because all these years I've been concentrating myself only to M.Pharm as well as PhD, things like that. I'll never have a chance to interact with you in the lower class. That's what will happen. Because physical pharmaceutics was one of the favorite subjects which I used to handle those days, very long back. Okay, and that was a subject, and I used to handle with a lot of passion. And nowadays, teachers, many of them don't even okay update themselves and try to teach you. Okay, that's a major issue with many of the people. So the knowledge, whatever we have, doesn't get percolated to your level. That's what I feel when you come to the higher class. So any difference between dermal and transdermal? Yes, I want answers. I want you people to reciprocate, nothing else. Yes, no answer. Nobody knows. Nobody knows because I've been. What is transdermal? What is dermal? What is transdermal at least? Yes. Yes. Nobody knows? Nobody wants to interact otherwise? You're able to hear me at least?
Yes, sir.
Ripia, what is dermal and what is transdermal? Tell. There's nothing wrong.
The transdermal is below the dermis.
Okay. Dermal is? Yeah, Ripia, yeah. Partially correct. You're trying to tell something good. Then, others also can open up. Please. Otherwise, you'll not learn. This online platform is such a thing like, unless until even I keep telling my son also, okay, whatever you know, please try to interact. Otherwise, what will happen is the doubt will remain as doubt. It will never get clarified. Okay. So whenever I always tell him also, I always advise you people also, whenever you encounter a good teacher from whom we can learn, okay, many teachers are there. There may be wonderful teachers. Many of them are very knowledgeable. I'm telling you. Okay. Many of them don't disseminate the knowledge that readily. Okay. Is it clear? There are three types of teachers if I go back and talk. Okay. One is a teacher who has got no knowledge. That's one thing. Okay. Second is a teacher, yes, with knowledge, with good knowledge, and who is not ready to share the knowledge also. That is also there. Okay. And third kind of teachers are there whom I think, yes, who are knowledgeable and who are ready to share. Okay. That is how I categorize teachers as. Is it clear? Okay. So whenever you encounter such teachers, you should also give your 100% so that you learn the most. That's what we ultimately want. Is it clear? That is what is my okay best avenue. Okay. So whenever you encounter such teachers, you should also readily interact so that you learn more from them. At whatever level it may be either B Farm or it may be a higher study. So the more you interact, the more you learn. Okay. None of us, for example, especially me, will not tell, oh, you don't know even this. I'm the last person to make the remark. Okay. I always appreciate that a student who is very poor in academics, my own classmates were there, who are really very highly esteemed industrialists today. Okay. They are the vice presidents of some of the companies. Okay. I'm just telling you, okay, sharing many thoughts of mine. Okay. Those days when I finished my B Farm, okay, I joined M-Farm because M-Farm I was getting more stipend when compared to any other pharmaceutical company. And there were some of my classmates, to tell you, who after B-Farm joined industry, okay, directly. And today they are at the level of vice president, okay, or managing director, okay. By default, because I was, okay, thinking that my stipend will be better, I joined my M-Farm. By default, I did my PhD. By default, I did my postdoc also. Everything happened by chance, he says. Okay, I was the last person to tell you again and again. Okay, there was the last person to aspire to go to America also. Many of the aspirants will be there. Okay, all these days, my days especially, who aspire to go to America, but none of them, many of them failed to, okay, yes, even get into America. Is it clear? So whenever you encounter a good teacher, let us learn. So how learning can happen? You have to interact. Unless until you interact, okay, I will not know what you don't know. So please interact during my session. That's what I always tell you. Yes. So without any apprehension, okay. Yes, you should not have any apprehension. Even I don't have any apprehension with my students also. So some of my students also have reached very high level. Okay. I being a teacher, they recognize me as a teacher, and I have no apprehension in telling that I don't know this. Okay. There's no hard and fast rule that whatever I know, you should know. Is it clear? There's nothing like that. Yes. So it's only a learning process for everybody. That's why I still keep learning. and the last person to tell I know everything in pharmaceutics. Is it clear? Always told you transdermal is my domain. Okay, because I proudly can tell. Okay, because there are several benefits. There are several awards because of transdermal. This is the domain. Okay, it's an upcoming stage in India. That's what I mean to say. Okay, so I'll go deeper and deeper. So any differences there, dermal and transdermal? Please feel free to interact. Are you able to hear me at least?
Yes, sir.
Helpa. Only Eritrea is talking. What about others then?
So dermal is the skin, sir.
Ah, ah, ah.
Transdermal is we apply the patches on the skin layer, so the below the skin, so the active ingredients go to the systemic circulation, sir.
In which case? In which case?
Mean based on the transdermal patches, sir.
Yeah. That is your reason. Obviously, you are absolutely correct. Dermal is, it reaches only the dermisma. It's very clear. Okay. Okay, the drug is
Yes,
able to
sir.
percolate only to the dermis. Whereas in transdermal, okay, you can see the cursor. For example, all of you can see the cursor moving. Yes. Are you able to see or no? At least this people should be able to
Yes,
tell.
sir.
Yes, see that
Yes, sir.
what should happen is these are the veins, the ones which are there in blue. Okay, and the red ones are the arteries. So what will happen is, you know that arteries carry what kind of blood? In your school, teachers should have taught you. Arteries carry what? Veins carry what? What do they carry? What do they contain? In very layman language, I'm asking you. Artery will carry
It's oxygenated blood, sir.
Oxygenated blood, sir.
arteries usually carry pure blood. Okay, your teachers would have taught you in that language. Is it clear? Yes. Veins will carry impure blood. Is it clear? Are you able to understand? So, arteries basically supplies all the nutrients to the skin, and what you can call it as the veins will usually carry the impure blood or deoxygenated blood or all the waste material, and it goes to the heart. That's what it happens. So transdermal is something like this. The drug has to pass, reach the veins here, somewhere here. Okay.
Excuse me, sir.
Tell. Yeah, ma.
Sir, can you speak little bit loud? It's not clear for her, sir.
For most of you, is it clear now?
Little bit loud, sir.
No. I am at a little bit of distance. Is it clear now? Now?
Yes, sir. Yes, sir.
Uh, yeah. So, transdermal, what will happen is the drug has to percolate along the whole distance, for example, okay, and enter into the dermis. From the dermis, what will happen is the drug is getting absorbed through the veins, which is in turn carried to systemic circulation. From there, usually it will get distributed to the target sites. That is what will happen. Is everybody clear with the slide? Yes?
Yes, sir.
Whereas in dermis, what will happen is the drug is only delivered only to this particular region. For example, there is swelling on the hand. Okay. Yes, you apply gel. That's what will happen. It is something called dermal delivery or topical delivery. That's the difference between what I can call it as dermal and transdermal. Okay. Transdermal is across the dermis. Okay. Is it clear? Is the slide clear now?
Yes, sir.
Okay. Shall we move further?
Okay, sir.
Yeah. So, what are the pathways of drug permeation? That was the main focus of today's presentation. Okay. There are three pathways which have been identified, as you can see. This is stratum corneum. What has been seen here, you can see the cursor moving. Okay, and this will be the dermal region. That's what I've shown. Okay, which contains the sebaceous glands, sweat glands, and these are the arteria, these are the blood vessels in general. Okay, so the drug has to pass through the stratum corneum, enter the dermis, and enter into the systemic circulation. That's a basic pathway what any drug has to follow. Okay, so for that, it can take up 3 different pathways. Am I clear now?
Yes, sir.
It can take up take up 3 different pathways, as you can see. Okay, the first pathway, as you can see, is called as intracellular route. Okay, this is our intracellular pathway. So this is what will happen. Okay, the drug has to pass through the cells like this. The cells are called as corneocytes. Corneocytes are basically dead cells, like something like you would have heard of, for example, in plant tissue, would have heard of parenchyma and sclerenchyma. Have you heard of those? Have you heard
Yes, sir.
of?
Yes, sir.
Yes,
Huh?
sir.
So something like that. So stratum corneum basically contains what you can call it as the dead cells. Okay, here there is a clear demarcation, as you can see. This is what you can call it as the viable epidermis. This part of the epidermis is called as viable, and this part is nothing but a dead one, dead cell, which are known as corneocytes. So this layer is the one which is the rate determining layer, or which is a slow process. That is what we study in the kinetics. Rate determining step. What do you mean by rate determining step? In other words, I can call it as a slow process. So the drug has to pass, if at all the drug passes directly through the cells, they are rich in keratin, they are dead cells. Okay, that route is known as intracellular route. Okay, usually what will happen is hydrophilic drugs or polar drugs pick up what is known as intracellular route. Am I clear? Yes. People should answer, otherwise there is no use.
Yes, sir.
Vidyashree, is it clear now? So, intracellular route, please note down also. Don't come and sit blindly. Is it clear? So, intracellular route is usually taken up by hydrophilic molecules. That is, what I mean by hydrophilic is water soluble or polar molecule. Is it clear? Yes. There is one more pathway. You can see here. Yes. See here, this is the pathway, for example, yes, which is known as intercellular route. That is, the drug has to pass through the or in between cells. Okay. So what will happen is here stratum corneum basically contains cells that are rich in keratin. Okay. But in between these cells, okay, something like a brick and mortar arrangement they call it. Okay. But in between these cells, the packing material is basically lipid. So what will happen is there are certain drugs which pass through the lipoidal region, as you can see here. This arrow mark very clearly indicates. Okay, this pathway is known as intercellular pathway or intercellular route. Okay, this usually is taken up by lipophilic molecules. Are you able to understand? Is it clear now?
Yes, sir.
Yes, sir.
So understood the difference intracellular and intercellular? Okay. Yes. Yes.
Yes, sir.
So there are one more route that is known as transappendageal route. That is, the drug may pass even through the appendage, as you can see. Okay, this is the sebaceous gland. What you can see, these are the hair follicles. Okay, and these are the sweat glands. There are chances that some of the molecules can pass through these appendages also directly and may reach what is known as systemic circulation. Okay, so this particular pathway is known as transappendageal pathway, or sometimes they call it as follicular pathway also. Is it clear? Are you able to understand?
Yes, sir.
So that is known as follicular phosphate. Even what I can call it as, yes, even these, for example, hydrophilic molecules or again water soluble molecules follow this particular pathway. Yes, is it clear now? Hello? Nihal is not answering today. Is it clear or no?
Yes, sir.
Yes, sir.
Okay, shall we go to the next slide quickly?
Yes, sir.
There is a disturbance, Bhargavi, at your end, maybe. My voice is clear? Is my voice clear?
Yes, sir.
Vidyashri, it's quite clear. Yeah. Vidya is quite clear. For me also, it's quite clear. Yes. So, what are the factors that may affect skin permeation? There's one more important slide. Okay. The first factor that affects skin permeation is the area of application. How big the patch is. Okay. So, more the area, yes, more will be the extent of absorption. Okay. That's the first thing. What can happen? Yes. More the area, the bigger the patch, more will be the amount of drug that may reach into systemic circulation. That's what will happen. The next is what you can call it as partition coefficient of the permeation. Okay, have you done partition coefficient studies? Have you done or no?
Yes, sir. Yes, sir.
Partition coefficient of which you have determined? You recall? You not at all done or you have done? Yes?
We have done, sir.
Sheetal, yeah. Which one? Which one? Of what you have done?
Benzoic acid distribution of benzoic acid between two different liquids. Two immiscible liquids, sir.
Yeah, immiscible liquids. I remember. What are the immiscible liquids you've taken? What are the immiscible?
Petroleum and ethanol.
Any other answers?
Benzene, sir.
Benzene.
Benzene and water.
Benzene water system. Sheetal is correct. Okay. Then what you try to distinguish between benzene and water?
Any drug molecules that distribute between, like it dissolves in, we see the amount which dissolves more in immiscible liquids.
Yeah,
How it
somewhere.
get partitioned, how it get distributed between two different kinds of
Excellent.
liquid. That is, one is hydrophilic and hydrophobic.
Good, Sheetal. Good. I made a good attempt. Okay. I think two things we used to make the students do. One is distribution coefficient of iodine between carbon tetrachloride and water. Okay, which you have already done in your PP, if at all. That's one experiment. The other experiment is distribution coefficient of what you can call it as benzoic acid between benzene and water. Am I correct?
Yes, sir.
Ah,
Yes, sir. Yes.
yes. So what will happen is benzoic acid has a tendency to get distributed based on the partition coefficient or the distribution coefficient into these phases. So partition coefficient eventually or finally is given by the formula of concentration of the drug in the organic phase divided by concentration of the drug in the aqueous phase. Is it clear?
Yes, sir.
That is what is the partition coefficient. So partition coefficient is one of the major factors that affects transdermal permeation. Okay. In what way it affects? For example, the previous one, molecular weight, what will happen is, smaller the molecular weight, better is the permeation. Okay. Usually if it is less than, for example, if a transdermal, any of subsequently I'll discuss, for transdermal permeation to happen or to pass through the skin, the molecular weight should be less than 400 Dalton. So this rule is known as 400 Dalton rule. Okay. So the molecular weight should be less than 400 Dalton. Okay. So the next is partition coefficient. Okay. So partition coefficient also should be in certain limits, which I will explain later. Third is skin hydration. So if the skin is hydrated, more is the permeation. That's what will happen. And lastly, it is duration of application. Okay. The more the duration of application, what will happen is, more will be the extent of absorption. Yes. Is it clear to everybody?
Yes.
Yes, sir.
Sheetal, is it clear? Only
Yes,
Sheetal?
sir.
Then what about others then?
Yes, sir.
Yes, sir.
Bhargavi. Bhargavi, did you understand?
Sir.
Did you
Yes,
understand?
sir.
Then.
Yes, sir.
Okay. Only girls are answering. What about boys, pa? Boys are sleeping. That's why I tell you to on the videos. No boys there in the class? No boys are there, Nihal?
Yes, sir, we were there.
Then? Then people should answer, at least. Whether you understood or not, also people, if you don't answer, then how I can proceed? Tell me. Aditi is there today?
Yes, sir.
Then, like how it is possible? If people don't reciprocate, how can I proceed further? Tell me. People should reciprocate. Okay, someone at least. Okay, shall I move to the next slide, Aditi?
Yes, sir.
So everybody, for example, at the end of this year, have the responsibility. Okay, so you have to either go into higher studies. Okay, so this is the criteria. Very important. I always tell my M.Pharm students also. Okay, so this is the criteria for transdermal permeation path. Okay, so if a molecule has to pass through the skin, these are some of the qualities which it has to possess. These are the prerequisites. Okay, what are the prerequisites? One is, as I told you, the molecular weight should be less than 400 Daltons. Second one is the log P. What is log P? Anybody has heard of log P? Any guess?
Permeation coefficient, sir.
No, log of partition coefficient is nothing but log P, nothing big in that. Okay, it's not any big
Okay.
sign or whatever it is. Okay, logarithm of partition coefficient is log P. So the partition coefficient is 100 to around 10,000. The log P automatically will be between 2 to 4. So it's easier for you to remember. Okay, that's the reason we express as log P, log of partition coefficient. Okay, then melting point. Okay, lower the melting point, what will happen is, better is the miscibility with the lipids, skin lipids. Okay, as I told you, stratum corneum, basically it's a lipoidal barrier. Anytime people will tell. Okay, it is made up of lipids. The matrix of stratum corneum is made up of lipids. So usually if the melting point is lower, okay, we assume that it will get miscible with the lipids and it will enter into the systemic circulation. Okay, so lipoidal drugs can pass through easily. Okay, the problem is with most of the water soluble or polar molecules. It should be difficult. Okay. And again, melting point should be below 200 degrees. That's one more thing. Okay. Next is what you can call it as a daily dose. Okay. What can be the most suitable dose? Okay. Of partition coefficient. And the thing is, it should be less than around 25 mg. Okay. That should be the daily dose. And lastly, what should be the, not that important factor, what should be the pKa? Okay, the pK value can be between 6 to 9. So these are the prerequisites for selection of what you can call it as any drug for transdermal delivery. The other thing is, it is preferable to go with drug with are meant for chronic administration. Only such drugs may be suitable many a times. And drugs with very short half-life, something like less than 10 hours. Less than 10 hours is suitable for what you can call the transdermal permeation. Yes, is it clear? Very important slide for you. Okay, is it clear?
Yes, sir.
So Sheetal is a very important slide, so which you people can have. Yes, even when somebody wants to work on higher studies, especially if they want to go to transdermal drug delivery, this particular domain, you're most welcome. Okay, these are prerequisites which you are supposed to know. Okay, and most importantly, it should be non-irritating and non-sensitizing to the skin. So these are some of the lists of the products which I've just listed out. Okay, yes, we can refer the textbook for reference is NK Jain. Okay, novel drug delivery system by NK Jain. That is a book for reference. Okay, that you can refer. These are some of the products which are already made into the market. Hardly there may be around throughout the US and India, the number of products or number of products which are made into the market, a number of molecules which are made into the market. Only a handful of products are made into the market. Very few of them. Okay. First, there's something like copolamine, which is used to treat motion sickness, and the next is for treating angina. Okay, nitroglycerin is a drug which is used for treatment of angina, which again is a drug of choice. One more drug, that is clonidine, which is used to treat hypertension. Okay, and the other drug is what you can call it as for smoking cessation. Okay, that is nicotine, that is again made into the market. Okay, the other is for hormone replacement therapy, that is estradiol. And wonderful drug, wonderful product, what I can call, which is even found in Indian market, I think, is fentanyl. Other than that, I remember one more molecule that is there in the Indian market, that is diclofenac. Any use of diclofenac?
Painkiller.
Anti-inflammatory, sir.
Yes,
Analgesic anti-inflammatory.
yes, sure. Okay. So I think Zydus has a product called New Patch. Okay. That is one of the molecules which is used as what you can call it as for transdermal application. Okay, it's called as New Patch. NUPATCH. Okay, that is the one. Okay. Shall we go to the next slide quickly? Yes.
Yes, sir.
Yes, sir.
Yes, sir.
Yeah. So also factors that govern the design of transdermal drug delivery system. One is, as I told you, therapeutic indication. The most important, any company before developing a patch, a transdermal patch, one thing, one reality I'm telling you to most of you people is, any company for that matter will prefer to go for a conventional drug dosage form. Okay, that is the preference of choice. Okay, many companies, most of the companies. Okay, and nobody prefers to develop a novel drug delivery system, because the reason for that is many of them, okay, the novelty will be there, but the performance will not be that great. That's what will happen. Okay, so transdermal drug delivery system was considered to be a novel drug delivery system. Nowadays, it's making it to the Indian market. Okay. Okay, that is what is going to happen. So what are the factors? So any company, they will tell you to develop either a simple what you can call a tablet, or a simple capsule, or a simple gel, or a simple ointment. All these are called as what you can call it as uh, the traditional or conventional dosage form. So this will come on transdermal drug delivery system is on the contrary, it's a novel drug delivery system. So the first factor that any company thinks about is therapeutic indication. Okay, there is two things which everybody is supposed to understand. Therapeutic indication means whether it is meant for acute or whether it is meant for chronic. Okay, what is acute? Yes, people know what is acute?
It shows symptoms and it is curable in a short duration or short amount of process of drugs.
Sheetal
You
is
see
passing.
signs and symptoms.
Yeah. Any other answers? Any other answers?
Sir, illness occurs suddenly and it shows for a short time, sir.
Yeah, I'm very much correct. Vidya is also correct. Sheetal is also partially correct. Okay. Acute is which is going to last only for a few days. Just like your fever, okay. Just like any common flu or any flu, what's happened is you're supposed to take an antibiotic for 5 days. Okay, it's only for 5 days. Okay, so usually it's only because it's only for 5 days, it's called as acute. There is something other condition called chronic. For example, diabetes, it is almost lifelong. Hypertension, for example, it's almost lifelong. Arthritis, for example, it's almost lifelong. So you saw the category of the drugs previously you just saw. Most of them are used to treat what is known as chronic disease. Okay, particularly cardiovascular, especially. So transdermal is usually the best suited one for cardiovascular drugs. And even for and then people, there is some noise at your end. Yeah. Uh, so usually transdermal drug delivery systems these are the ones which are meant for chronic administration. So any company which at all tries to develop, okay, yes, this transdermal patch, the molecule should be a chronic one. Okay, that is where the patient has to take almost lifelong. CNS also is one of the drugs. Okay, CNS drugs. Okay, cardiovascular is one more domain. That's the first thing. Do you understand about therapeutic indications? Yes? Yes or no?
Yes, sir.
If,
Yes,
uh,
sir.
the next is what is the desired what you can call it as drug release profile? Okay, to what extent it has to release the composition. There is one more thing. That is the dose and the duration of application. That's very important. Okay. In abroad, what will happen is usually once a week patch is also available. Okay. A patch which is applied once and which can last for almost 1 week. Even such patches are there. Okay. In many other patches are there which are meant for even once a day application also. Okay. So again, the duration also has to be considered. The dose has to be considered. I told you what is the optimum dose. What is the right dose? What is the correct dose? I told you. No answer. In the previous slide, I just told you. Nobody remembers.
Less than 10, 25 mg.
Ah, people correct. It's less than 25 mg. Okay. If somebody tells you to develop a transdermal patch of paracetamol, it is practically impossible many times. Okay. Yes. Is it clear? Are you able to understand?
Yes, sir.
So that is the key. That is what the people have to know. The next is skin adhesion. That is how well it is adhering to the skin. That's very important because the adhesion has to happen very firmly, like your band-aid. Okay. Yes, it has to adhere very firmly to the skin. The next is the ease of application, how easily it can be applied and the application time. Ease of application, something like your handy plasma. Okay, so it should be easily applied to the skin. Okay, and it should be easily removed. So once it is applied, it has to sit firmly on the skin. Okay, yes, that is what you call it as at the microscopic and the macroscopic levels. That is what you tell. Okay, that is, it has to adhere firmly to the skin. And during removal, what will happen is there are other issues what may happen. For example, okay, all the hairs that are present on the surface of the skin may get peeled off. Or sometimes there are patches which may leave some residue on the skin. All that you would have seen, for example, when somebody applies a plaster. You have encountered that? Students have seen that?
Yes, sir.
All those issues should not be there. Okay. Yes, it should sit firmly on the skin, but at the same time, it should not adhere too firmly so that it's peeling out or removing the patch should not be a difficult task for you. Is it clear? Are you able to understand? Is it clear now? Yes?
Yes, sir.
And again, it should not leave any residue on the skin. For example, some handy flash you would have come across where there is a residue on the skin. I don't know whether how many of you have observed. Yes? So that's one more issue. It should not leave any residue on the surface of the skin. Is it clear? Yes? Are you able to understand?
Yes, sir.
Yes,
Yes,
sir.
sir.
One more thing what you need to consider is the patch size and the shape. Okay, you can make it into a very attractive shape. Okay, you can give a very nice shape. Okay, square or a circle is a very good shape. Okay, round color, what is a round, I mean to say. Okay, and then one of the other factors which need to be considered are the packaging, how you are going to finally present, and even finally the patch cost. Usually the size, the cost is relatively high because it's a novel drug delivery system. There is a technology that is involved in this case. It is not as simple as a conventional dosage form. So these are the factors that need to be considered while designing a transdermal system. Is it clear? All of you are clear?
Yes, sir.
So the rest I'll continue in my next class, whatever said and done. Okay. And so we'll meet next week. Till then, you people can take care. Okay. Is it clear? Okay. Is it
Yes,
fine?
sir.
Do you understand?
Yes, sir.
Yes, sir.
Yes, sir.
Yeah. Okay, ma. See you next time. See you next week, probably. Okay. Okay then. Bye. Take care.